Viral hepatitis. Viral hepatitis has gained prominence in the public and global health owing to its increasing incidence and its accompanying morbidity and mortality globally. Viral hepatitis is defined as an inflammation of the liver parenchyma that is caused by a variety of infectious viruses. Of all viral organisms, the most common type of organism which are implicated and have become the public health concern are the hepatovirus, which will include the hepatitis A, B, C, D, and E virus. Other viruses which have also been implicated will include the cytomegalovirus, the Epstein-Barr virus, the yellow fever virus, and the herpes simplex virus. However, for the purpose of this discussion, we will be focusing mainly on the public health concern, the hepatovirus. And to start with, hepatitis A. Hepatitis A is caused by the hepatitis A virus, which is an icosahedral, non-enveloped virus belonging to the virus family called the Picornaviridae. Hepatitis A is a positive sense single strand of RNA packed in a protein shell. And maybe you're wondering what a positive sense strand is. So, a positive sense strand is a non-template strand whose nucleotide sequence is equivalent to the sequence of the messenger RNA transcript, and thus can immediately be translated by the host protein synthesis machinery. You got that? So, hepatitis A is known to have one serotype, however multiple genotypes exist. Now, let's talk the numbers and its distribution. It's estimated that 1.4 million symptomatic cases occur each year and about a sum of 114 million infections globally. It is more common in developing regions of the world, such as Africa and South America, as these regions are attributed with poor sanitation and inadequate safe water. Infection in early childhood is the norm in these regions and is usually asymptomatic, with the age of acquisition being in and about the age 2 going through to 10 years of age. And to back this up, it is noticed that the highest prevalence of antibodies to hepatitis A virus are observed in adults in Africa, Asia, as well as South America, indicating evidence of past infection which is nearly universal. Hepatitis A virus infection also occur in the developed region. However, the age of incidence is quite different, as it occurs in and about the age of 5 to 17 years of age. And within this age range, the illness is also mild and usually subclinical. It goes without saying that there is no sexual predilection to this infection. So, how does one get infected? Its mode of transmission is fecal-oral, that is, it is spread by eating food or drinking water contaminated with infected feces. A common reservoir or intermediate host aside humans for the virus is undercooked or raw shellfish. It may also be spread through close contact with infectious person, with the period of peak shedding of the hepatitis A virus being during the prodrome phase, which is around the 14th to 21 days post-infection, and thus correspond to the time when the transmission is at its highest. The virus could be quite stubborn, as it is resistant to denatured by ether, acid with a pH as low as 3.0, drying, and temperature as high as 56 degrees Celsius and as low as minus 20 degrees Celsius. Hepatitis A virus has been seen to be viable for many years. Incubation period for the infection is between 2 to 6 weeks, with an average of 4 weeks, that is 28 days. And symptom manifestation could range from asymptomatic, which is usually common among children with approximately 90% of cases, Otherwise, there could be fever, fatigue, nausea, loss of appetite, jaundice, diarrhea, passage of dark colored urine, pale colored stool, as well as abdominal discomfort. The presence of disease manifestation and the severity of symptoms after hepatitis A virus infection directly correlate with the patient's age. As for diagnosis is made by detection of hepatitis A virus-specific immunoglobulin M antibody in the blood, which can be detected as early as the second week post-infection and lasting up to the 14th week. Also, liver function tests done on infected individuals have seen a rise in liver enzyme with alanine transferase rising as high as 1,000 units per liter. Complications to the infection will include acute hepatitis. A more severe form of hepatitis could also occur in the form of the fulminant hepatic failure. Other complications, however rare, will include acute renal failure, pancreatitis, red blood cell aplasia, agranulomatosis, bone marrow aplasia, and so on. Prognosis. Prognosis is quite excellent to the infection, as the infection is usually self-resolving and subsequently confers immunity. The singular most important determinant of illness severity is age, as increasing age is directly correlated with an increasing likelihood of adverse events. Most deaths from acute hepatitis A virus infection occur in persons older than 50 years of age, even though such infections are uncommon in this age group. Another good prognosis is that chronicity of this infection does not exist. The pathogenesis and symptom manifestation can actually be prevented by vaccination, which has been proven to be efficacious with little or no side effects. Other measures which are equally important will include good sanitation and hygiene and properly cooking meals, especially those with shellfish. Treatment as with most viral infection is mainly supportive and symptom-based, as infection is usually self-limiting. That wraps up what we have for you on hepatitis A. Be sure to subscribe to our channel and give this video a like by clicking on that thumbs up icon. And to stay up to date with our uploads, kindly click on the notification bell. See ya!